Good morning, how are you doing? Nice to see you. How are you?
Last year, Boris Johnson might have responded to a moment like passing the 15 million target with cheering language about easing the lockdown soon. This year, a new approach. His team has agreed it must avoid over-promising. The Prime Minister signalled a slower lifting of controls than might have been hoped for, in the hope, he said, there would be no more national lockdowns after this, the third one.
We want this lockdown to be the last, and we want progress to be cautious, but also irreversible.
He was asked if he could give a cast-iron guarantee there would be no more national lockdowns.
But to say I can give an absolute cast-iron guarantee that we won't face further difficulties and, have to think harder and deeper about some problems. No, Alex, at this stage, I can't.
I think it's quite likely that this will be the last lockdown that we have because, to a large extent, the purposes of the lockdown were to control the pressure on the NHS.
What would you say the odds are that we have another lockdown, though, next winter?
I would guess it's probably less than about 1 in 4. Less than a 4-to-1 odds, but that is a very wild guess, really.
The Prime Minister said he didn't think vaccine passports would be part of everyday life in the UK, but he thought taking a lateral flow test might be a requirement before you can go to the theatre or other mass indoor events.
Lateral flow testing or rapid testing for those bits where, it is that have been the toughest nuts to crack, as it were, such as nightclubs or theatres, those parts of the economy we couldn't get open last year.
The cautious approach is alarming some Tory MPs. 60 of them have signed a letter calling on Boris Johnson to lift all COVID restrictions by the end of April. The Prime Minister might feel he lent into your view of the world, you and your gang's view of the world, last autumn, and a lot of good it did him with the winter surge in infections.
Well, the Prime Minister might be thinking that, but the wheels fell off the then projections of deaths, and indeed we were not given access to the underlying data regarding the hospital projections.
Well, we don't know whether they were wrong at all, do we? If there hadn't been lockdown controls, death rates would have been even vaster than they were this winter.
I read a paper last night which seems to show that the most restrictive non-pharmaceutical interventions, like closing businesses, actually don't show an appreciable benefit over some of the less restrictive ones, like hands, face, space, and stopping mass gatherings.
My sister's a carer, and she said, Dave, just get it done. So you've got to for the population.
I don't think anybody should be up thinking too far ahead about anything. We need this, nip it in the bud. The country can't afford to go through another lockdown.
A West London vaccination centre today. The government's chief medical officer said there wasn't yet enough data from those who've been vaccinated to be sure how much protection the jabs are giving. That information will build towards the end of the week. It'll feed into an end-of-lockdown plan that's expected to be more cautious than the one the government published before last summer. Well, we're in this strange limbo as the government waits for the data, but what you could see Boris Johnson doing there was rolling the pitch ahead of his announcement on the way out of lockdown. And he's doing what there were a couple of councils of war within government end of last year, beginning of this year, where they sat around and said, this over-promising lot that you keep doing, Prime Minister, it really isn't helping us. And you can see that the Prime Minister is trying to play down expectations of this release from lockdown. It won't be some great liberation. The thing we really learnt, the concrete thing that we learnt today, though, because they're in this limbo and they're not telling us much, is this idea of using rapid flow tests, the quickie tests, near venues where concerts might be taking place, the theatre, things that the government just hasn't found a way to open since last March. It sounds as though not just that they're looking seriously at having lots of these testing sites maybe close to a venue like that so you can take your test on the way in, but the truth is they're not quite sure how they could reopen those venues without something like that.
Gary, thanks very much. Now, the first travellers have been checking into quarantine hotels as part of tougher restrictions to curb the spread of new COVID variants. Anyone arriving in England from 33 red list countries where worrying strains are circulating now has to pay just over £1,700 to quarantine in specially designated hotels. The same rule applies in Scotland to arrivals from any destination outside the common travel area. So how well is the system working? Kamian Zerum has been finding out.
At Heathrow this morning, the very first passengers flew in from the 33 countries on the COVID red list, then bussed to a quarantine hotel at £175 a night for 10 nights. Wagner and Elaine came back from Brazil via Madrid.
We cannot walk in the corridor, we can't do nothing. It's like a prison with a nice bed and a TV.
For passengers who might try and avoid this, draconian new measures from 10 years in jail to £10,000 fines. But will the processes behind the new system actually work?
Welcome to Blighty in the middle of winter, which lands us with the potential loophole. Flying in from a red zone country, well, what you're supposed to do is spend the better part of £2,000 on a quarantine hotel here, 10 days locked in a room. Now, what some people might be tempted to do is to break their journey for less than 10 days en route in a non-red zone country.
You'd still have to quarantine, but in the comfort of your own home. The Home Office says it scrutinises passports and the information every visitor fills out in passenger locator forms, lie about where you've been, and risk one of those hefty penalties. But in those moments when passengers first land, how will arrivals from different parts of the world be kept apart? And once they get to quarantine hotels, how will exposure to staff be reduced?
As things stand, we haven't had the guarantees that we would like to ensure that our members working on the ground at Heathrow are safe, and clearly the knock-on impact of that being that the passengers arriving are safe, because if you don't have adequate segregation of passengers getting off of these red list planes, then really the policy has failed at the first hurdle.
Another hurdle in Scotland, all overseas visitors, not just those from red list countries, must quarantine in a hotel. Today's flight from Istanbul was meant to have 65 passengers. In the end, only 4 turned up. So what's to stop visitors to Scotland trying to cheat the restrictions by flying via England instead?
So unless we impose managed isolation in a comprehensive way, we risk letting the virus come in. Now, clearly, we can only do that directly for people coming directly into Scotland. And for people who intend coming to Scotland but fly via Heathrow, for example, we have to work with the UK government.
I'm glad to say that the reports I've had this morning are that it's all gone smoothly so far, that people are respectful of the need to quarantine for 10 days in a hotel if they've been in a high-risk country.
But from inside Heathrow today, a glimpse of just how close passengers might come to those on the red list. The latest measures to try and halt the spread of new COVID mutations.
Kamian Zerum reporting there.